There are now measles outbreaks in at least 12 states, as cases jump by a third week over week. Last year, there were only 285 documented cases of measles in the whole United States. This year, it's only March, and there are already 246 cases. Disease killed a 6-year-old in Texas last week, the first death from measles in the U.S. in a decade. And then this week, an infected adult died in New Mexico. Both were unvaccinated. Measles is one of the most contagious diseases in the world. We have a vaccine that is 97% effective in preventing it. But we also have a Secretary of Health and Human Services who says the decision to vaccinate is a personal one, while touting vitamins and steroids and ambulance rides instead.
Right now, we have we're delivering vitamin A. We are providing assistance if people need ambulance rides, and they're getting very, very good results. They report from budesonide, which is a steroid. It's a 30-year-old steroid. And clarithromycin, and also cod liver oil, which has high concentrations of vitamin A and vitamin D.
Dr. Peter Hotez is the co-director of the Center for Vaccine Development at Texas Children's Hospital. He's also dean of the National School of Tropical Medicine at Baylor College of Medicine and author of The Deadly Rise of Anti-Science, A Scientist's Warning. He spoke at a press conference on the measles outbreak in Texas just this week, and he joins me now. Doctor, I'm trying to be open-minded, or at least charitable, but it seems strange to me that the Secretary of Health and Human Services, in the midst of a deadly measles outbreak, has not on camera urged people to get vaccinated once, so far as I can tell.
Yeah, and he actually wrote an opinion piece in for the Fox News website where he started talking about the vaccine, but then he didn't talk about its effectiveness and why it's safe, instead pivoted to everything else, including some of the things that he mentioned and what you just played. The point is that, Chris, this is a very dangerous measles epidemic here in West Texas and now moving into New Mexico. The official numbers are close to 200, but the actual numbers, according to people on the ground, suggest there could be much higher. There could be several hundred cases right now and more than 20 hospitalizations, 2 deaths already. And you know what? This is still accelerating, Chris. We still may not have peaked and may still be in the early stages. So it is the only thing we can really do to slow this epidemic right now is to encourage people to get their MMR vaccine, one of the safest, most effective vaccines that we have. And he seems to be talking about everything else but the vaccination. It just makes no sense. Fortunately, we have a very good state health department here in Texas, great local county health departments, and they're doing the hard work to make that happen. But it's the secretary is not helping at this point.
Let me ask you a question, informational question. So Gaines County, which is the place where I think the outbreak started, as far as we can tell, or at most intense, has one of the highest vaccine opt-out rates in the state. It's at nearly 18% vaccine exemption, so that it puts you at 82%, far from the herd immunity you need at sort of 95. In the midst of an outbreak, if people haven't vaccinated, does it help to go get vaccinated like tomorrow?
Yeah, absolutely. In fact, Chris, not only that, even if you've been exposed to measles, if you get vaccinated within 72 hours after exposure, it will have mitigating effects to either prevent you from getting sick or reduce the severity of illness. It's called post-exposure prophylaxis, and that's what we're pushing for, because there is a lot of measles exposure going on, and it's never too late to get vaccinated. So it's all hands on deck. I know I sound like a broken record, but that's it. Vaccinate right now in order to literally save lives, since we've already had 2 deaths.
Let me just show this chart that shows sort of what our trajectory of measles has been. 1963, when the vaccine was licensed. The second dose is recommended in 1989 there, and then you see elimination declared in 2000. Not so eliminated right now, but I mean that's what the vaccines did. The CDC has also announced, and again, I have to imagine this is coming directly from the top from RFK, that they plan to study vaccines and autism. This is a much debunked link. There was quite notoriously a Lancet study published several decades ago that was subsequently retracted. It did a tremendous amount of harm. This is actually something that you have spent a lot of time on and even wrote a book about. Vaccines did not cause Rachel's autism. My journey as a vaccine scientist, pediatrician, autism dad. As someone who has specific expertise here, what's your reaction to the CDC announcement?
Well, I wrote that book after, for a year, having long conversations with Robert F. Kennedy Jr. in 2017 at the request of the National Institutes of Health. And what it does is it details the strong evidence, 2 decades of evidence, showing there's absolutely no link between vaccines and autism. And the goalposts keep moving. At first it was the MMR vaccine, they said. Then RFK Jr. wrote an article in Rolling Stone magazine saying it was the thimerosal preservative that used to be in vaccine. Then it was the HPV vaccine, and then it was spacing vaccines too close together, alumin vaccine. And each time the scientific community's debunked it. But the other point, Chris, and this is probably the most important point, is the lack of plausibility. Autism begins in with fetal brain development in the first and second trimester of pregnancy, well before kids ever see vaccines. We have detailed knowledge of this. We have 100 autism genes that have been identified. We even sequenced my daughter's Rachel's autism gene, and along with my wife and I, Ann and I, and in order to find her autism gene. So it's a lack of plausibility. Interestingly, it doesn't mean there can't be any environmental influence, but if it is, it's around the time of conception in the first trimester of pregnancy interacting with autism genes. So, for instance, one of the things I remember talking to RFK Jr. about back in 2017 is if you're pregnant but are not aware of it, and you're taking an anti-seizure medication called Depakote, also known as valproic acid, your child has a higher likelihood of being born with an autism-type phenotype because it's interacting with the genes early on in pregnancy. And there are other chemicals that can do that as well. I said, Bobby, you're an environmental attorney. This is what you should be all over this, and I really couldn't engage him. And so there is a need to understand more about autism and understand environmental influences, but in associated with pregnancy, nothing to do with vaccines.
Dr. Peter Hotez, always a pleasure. Thank you, sir. Appreciate it.